So today we'll be discussing muscles of mastication. So there are usually four types of muscles. Four muscles we see in mastication, which help in mastication. So there are the masseter muscle, the temporalis, the lateral pterygoid, and the medial pterygoid. Out of all this, the lateral pterygoid is the most important because it helps in depression of the mandible, and the other three, 1, 2, and 3, they do not help in depression of the mandible. They elevate the mandible. This one, this, and this. So that's why the lateral pterygoid becomes the most important, because it stands out from the rest. And then moving on to masseter muscle. So the origin of this, it has three origins. Okay, superficial layer, middle layer, and deep layer. So the superficial one is from the anterior 2/3 of the lower border of zygomatic arch. So this, so the superficial layer, which is the largest, okay, this is the largest, let me just write it down here. So this one is from the anterior border, anterior 2/3 of lower border of zygomatic arch. And zygomatic process of maxilla. So the origin of masseter muscle, the superficial one, which is the largest, is from the anterior 2/3 of the lower border of zygomatic arch and the zygomatic process of maxilla. So that's where the superficial layer takes origin from. Now this is the middle layer. The middle layer is from the lower border of posterior 1/3 of zygomatic arch. So this was anterior 2/3 of lower border of zygomatic arch and the superficial layer, and the middle one is from the lower border of posterior 1/3 of zygomatic arch. So from lower border of posterior 1/3 of zygomatic arch. Okay, so you can see, if we come here, the superficial layer is from the anterior 2/3 of lower border of zygomatic arch, while the middle layer is from the lower border of posterior 2/3 of zygomatic arch. So the deep layer, which is the third and last layer of the origin of masseter muscle. So the deep layer is from the deep surface of zygomatic arch. So all of them take origin from the zygomatic arch. Okay, and the deep layer takes origin from the deep surface of zygomatic arch. So that's about the origin of masseter muscle. Okay, so let's just go through it once more. So the superficial layer takes place from the anterior 2/3 of lower border of zygomatic arch. Middle layer takes origin from border of posterior 1/3. Okay, remember this 1/3, 2/3, this is very important, of zygomatic arch, and the deep layer takes origin from the deep surface of zygomatic arch. So that's about the origin of masseter muscle. Now insertion. So like the way it had 3 origins, 1, 2 and 3, it will have 3 insertions. Okay, so now this superficial layer. So superficial layer, the insertion is into the lower part of the lateral surface of ramus of mandible. Into lower part of lateral surface of ramus of mandible. So it's common sense. These muscles, they act on the mandible to move the mouth. That's why they're called muscles of mastication. So they will all be attached to the mandible. That's one common thing in masseter muscle. And the origin, the common thing is the zygomatic arch. H is missing. So the origin, common thing is zygomatic arch, and insertion, the common thing is mandible. So that's the superficial layer. The middle layer, its insertion is into the central part of ramus of mandible. So central part of ramus of mandible. Oops. And the deep layer, the third layer and the last one for masseter, it's into the rest of the ramus of mandible. Rest of ramus of mandible. So just to revise this once more. So the insertion of superficial layer is into the lower part of lateral surface of ramus of mandible. The middle layer is into the central. Superficial is into lower. Middle is into central. So central part of ramus of mandible. And the deep layer is into the rest of the ramus of mandible. So apart from this two, whatever is the mandible left, the deep one comes and inserts into that. Okay, so this is about the origin and insertion of the masseter muscle. If you guys want to see the whole thing here. Okay, now coming to the nerve supply. The nerve supply is only by one nerve. That's the masseteric nerve or masteric nerve, however you want to pronounce it. Masteric nerve, which is a branch of, this is important, which is a branch of anterior division of mandibular nerve. So that's about the nerve supply. Okay, now coming to the action. So like I said, only the lateral pterygoid depresses the mandible, the rest elevate it. So of course this will help in elevation. So this one, it mainly has two functions. So one is to elevate the mandible, and the second one is to, wait, you guys know what elevate means, right? So this one's usually to help in biting of food, stuff like that. Well, biting of stuff. And it helps the superficial fiber especially, okay? The superficial fibers or layer, whatever you want to call it, they cause protrusion. So this is about the masseter muscle. So now come to the temporalis muscle, which is the next muscle of mastication. So the origin for temporalis, it has two origins. One is from the temporal fossa, excluding the zygomatic bone. So you need to mention that, okay? Temporal fossa, excluding zygomatic bone. Okay, this is important. Okay, that's one of the origins, and the second origin is from the temporal fascia. This is not as important as this, but it's important as well. Temporalis fascia. So these are the two origins of temporalis muscle. Now coming to the insertion, it has two insertions as well. The margins and deep surface of coronoid process, and the other insertion is anterior border of ramus of mandible. So the first one is margins and deep surface of coronoid. That's one. And the second one is anterior border of ramus of the mandible. These are the two insertions. So let's just go through this again. Let's use this now. Let's use green. Okay, so origin of temporalis, temporal fossa excluding, okay, excluding, not including, excluding zygomatic bone, and the temporalis fascia. Now insertion is into the margins and deep surface of coronoid process, okay, and the anterior border of ramus of mandible. This two, it's quite simple. That's it. Okay, that's for the origin and insertion. Now coming to the nerve supply. The nerve supply is by two deep temporal branches. Okay, two deep temporal branches. Now this two deep temporal branches are branches from the anterior division of mandibular nerve. And if you guys remember of the masseter muscle, that was masteric nerve, which is a branch of anterior division of mandibular nerve. So these two nerves, they arise from the same branch, which is the anterior division of mandibular nerve. So this is anterior division of mandibular, okay, nerve. Okay, now come to the action. So you guys know elevates, the three have the same action. So elevate mandible, and this one helps in side to side grinding movement. Okay, side to side grinding movement. And the posterior fibers, they retract the protruded mandible. So the posterior fibers of what? Temporalis, they retract the protruded mandible. So you can say it works opposite to masseter muscle. Because the masseter muscle, it does what? It causes protrusion. So once the masseter muscle has done its job, which is protrusion, so the temporalis comes in to make it back to normal. So what does it do? It retracts it, bringing it back to the normal position. Okay, so this is for the temporalis muscle. These are the, if you want to take a screenshot. So now we're coming to the lateral pterygoid. Like I say, this is the only muscle, okay, only, let me write that, which causes depression of mandible. So you can relate this muscle to your X, if that's how you want to remember it. So the upper head, okay, now come to the origin. So there are two heads, okay, the upper head, which is smaller compared to the lower head, and the lower head, which is larger. Okay, this muscle is conical in shape. It's not important, but I'm just stating it. Conical in shape. Okay, and it's a short muscle. That's not important, but like just stating it. Anyway, so the origin, the upper head is from the infratemporal surface and crest of greater wing of sphenoid bone. Okay, so it's from where? It's from infratemporal surface and crest of sphenoid bone. Okay, that's about the upper head. Now coming to the lower head. The lower head is the larger head and it's from the lateral surface of lateral pterygoid plate. Okay, and the origin is medial to insertion. So it's from the lateral head, lateral surface of lateral pterygoid plate. Okay, now the insertion, so the fibers, they run backwards and laterally and they converge for the insertion, and the insertion is into the two, okay, two which you need to state at least in the exams, but you can remember one. It's really not important to remember, but for exam point of view it's important, especially clinical. So its insertion is into the pterygoid fovea on the anterior surface of neck of mandible. So pterygoid fossa, fovea, my bad, pterygoid fovea, okay, which is at the below, it's on the anterior surface of neck of mandible. Okay, let me just write that. Anterior surface of neck of mandible. And then the other insertion is into the anterior margin of articular disc and capsule of temporomandibular joint. Okay, so the other insertion is into the anterior margin of articular disc. Okay, if you remember this much, it's enough, but you can just add, if you remember, it's well and good, otherwise it's fine. And capsule of mandibular temporomandibular joint. Okay, you need to remember. I mean, if you remember the first one, it's enough. It's fine if you remember the second one. The first one is the most important in this. Okay, that's about the insertion. Now we're talking about the origin, insertion. Now coming to nerve supply. So now the nerve supply is from an anterior branch of mandibular nerve. Here you just need to remember that much. So anterior branch of mandibular nerve. Okay, and like we see, it depresses the mouth. This is the only muscle which depresses the mouth. That's it. It's an important muscle. Mandible, or opens the mouth, it depresses the mouth. Okay, and then it also helps in protruding the mandible. Let me just mention that. Okay, this too you can remember, but you have to remember this no matter what. It's very important. So it depresses the mandible. I'll just write it again. Okay, so action, like we said, this is the lateral pterygoid. It depresses the mandible. Okay, it protrudes the mandible. Okay, and then its nerve supply it's from a anterior branch of mandibular nerve. Talking about the origin is, just remember this much. So it has upper head and lower head. Okay, the upper head is from the infratemporal surface and crest of sphenoid bone, and the lower head, which is the larger head, which you can't see here, but yeah, which is the larger head, is from the lateral surface of lateral. Okay, you can see lateral comes twice. Lateral surface of lateral pterygoid plate. Okay, and the insertion, it's good if you only remember this. I mean, you only need this. Is the pterygoid fovea, which is present on the anterior surface of neck of mandible and the anterior margin of articular disc and capsule of temporomandibular joint. So this is about the lateral pterygoid. I think I'll make a detailed video about this because it's really important. So this is the lateral pterygoid. Now coming to the medial pterygoid. So the origin, it has again two heads: superficial head, which is a small slip, and the deep head, which is quite large compared to this superficial head. Okay, this is really small, so you can call it a small slip. And this is large. Okay, so the superficial head, okay, the origin is from the tuberosity of maxilla and adjoining bone. So tuberosity of maxilla and adjoining bone. Okay, the deep head. So the deep head is from the medial surface of lateral pterygoid plate. Medial surface of lateral pterygoid plate. So you see, the lateral pterygoid, the insertion was into the origin of the lower head was from the lateral pterygoid plate. Okay, lateral surface of lateral pterygoid plate. That's lateral pterygoid lower head insertion origin. Origin of lower head of lateral pterygoid. It's from the lateral surface of lateral pterygoid plate, and the origin of the deep head of the medial pterygoid is from the medial surface of lateral pterygoid plate. So this is medial pterygoid, so medial, that's lateral pterygoid, so lateral. Okay, you can remember it that way. So the insertion up here, I forgot to mention medial surface of lateral pterygoid plate and adjoining process of palatine bone. And the insertion is into the roughened area on the medial surface of angle and adjoining ramus of mandible. Okay, roughened area of mandible wait, let me just write it properly. Roughened area of medial on medial surface of angle and so this is the insertion of medial pterygoid. Roughened area of medial surface of angle and adjoining. Is this clear? Okay, I'll just try this again. Adjoining ramus of mandible. Okay, and the nerve supply is nerve to pterygoid, nerve to medial pterygoid. Which is a branch of main trunk of mandibular nerve. Okay, and the action. So this one elevates mandible and helps protrude the mandible as well. So this is the origin, insertion and nerve supply and action of medial pterygoid. So with that we have completed the muscles of mastication. So I'll just slide this through. This is my first video, so I'm kind of sorry about a lot of things. But like the notes and like whatever I've written all are correct. So you don't need to worry about that. Thank you.